Marietjie, I hope I've said name properly, Senior Lecturer, University of Johannesburg, South Africa, and a Fellow of the American Academy of Optometry. Please, Doctor, take us away.
Thank you so much for the opportunity. So I'm introducing a 3-step hand hygiene model for optometry. And what the research started looking at the 5 moments of hand hygiene. If we can have the next slide, maybe. But looking at the 5 moments of hand hygiene as proposed by the WHO. And the students it was optometry students that were observed their hand hygiene actions during a visual examination. And we used the standardized WHO observation form. And 39 students were observed before COVID-19 and 27 students during COVID-19. And specifically what was applicable was moment 1 of the 5 moments of hand hygiene. That's before touching the patient. Moment 4 was after touching the patient, and then moment 5 was after touching the patient's surroundings. And the 5 moments of hand hygiene is actually prescribed by everybody as the hand hygiene model to be used in practice. And if you look at it, there's no other model for optometry that is an alternative except for the WHO. So this was then investigated. And if you look at the figure then, the students were observed and the compliance rate was calculated. So for each hand hygiene action, meaning picking up an instrument or touching the patient's face or where the patient touches equipment, divided by the hand hygiene opportunity, and we calculated hand hygiene compliance, and the compliance rate was only 2.06%, meaning that during the visual examination, there wasn't enough time for them to apply the 5 moments of hand hygiene as prescribed by the WHO. And what the research then indicated was that an alternative model, and that is also suggested that an alternative model should maybe be applied specifically for the certain profession that we're looking at. So the proposal was done according to the observations, and there were certain areas that were completely ignored by the students during the visual examination, such as the chair, the table, the door handle, the phoropter wasn't cleaned, the trial frame wasn't cleaned. So these, and if you think about COVID-19, these are areas where the patient made contact with equipment, or patient made contact where the student and the patient made contact with the surface, and that could transfer, cross-contamination can take place, as indicated at healthcare workers. That is where most of healthcare-associated infections can be transferred. So what is suggested is a general hygiene 2-step and then a 3-step hand hygiene model that we are proposing. So initially it is before the start of the day, the general hygiene process is suggested, and it's deep cleaning of the whole examination room. And according to the WHO, hypochlorite is what can be used. So the surfaces and the chair and the table, the door handle, the light switches should be cleaned with water and soap, followed by a diluted hypochlorite solution. That can take place at the beginning of the day. Then meet and greet the patient. And then the hand hygiene action number 1 should take place, where the hands should be cleaned in front of the patient so that the patient can see that that hand hygiene action has taken place. Part of this research has shown, and this is not in this poster, but that patients actually want to see that you are cleaning your hands and that the surfaces are clean. So that is hand hygiene action number 1. What is proposed then, hand hygiene action number 2, is when there is an additional procedure required, such as inserting lenses, contact lenses, or when it is gonioscopy or anything like that, that there should be an additional hand hygiene action that takes place. So you clean initially before before you start the general examination. But if there's additional procedures required where you will touch the patient's face, or where such with contact lens insertions, that hand hygiene actions should take place again. And then the third one is at the end of the examination, when the patient leaves, then obviously the equipment that was used can then be cleaned, and a general wipe down needs to take place, and that is the general hygiene number 2 that takes place before at the end of the day you start again with your normal day-to-day examination again. So that was what we're proposing in place of the 5 moments of hand hygiene, is the visual examination. And in certain instances, you have a full day of 16 patients ahead of you. It is just not, there's not enough time to wash your hands continuously as you touch a surface, as you pick up your instruments, clean it. So if you have got a deep clean in the beginning of the day and wiping down surfaces at the end of the day, that is enough to clean the room, as it is a low to a medium risk according to the WHO. That is enough to clean the room and prevent the cross-contamination of surfaces. And we do not need I don't want to say do not need, but the WHO 5 moments of hand hygiene then is not that much applicable within the visual examination room or during the visual examination. Thank you. There's a question that I test the proposed model. We just calculated compliance rate when the observations took place. So that was 2.06%. So that the model has not been tested. This will, we will now test it. It will take place this year. We've got permission to continue the research this year.
Excellent.
So I'm sorry, I'm taking questions and I didn't give you a chance. Sorry, Prof.
No, that's okay. No worries. We still have a minute and a half for questions of Dr. Richard's research.
Yeah, can I go now, Marietjie? I think what a wonderful presentation it was. And your last comment was that WHO does not recommend cleaning between patients. So if you clean in the morning, more like you come into the office, it's enough when you clean morning and then when you finish work. How about between patients transition? During COVID, I think here it was mandatory that you clean your surfaces in front of each patient and wash your hands before touching each patient. So do you say, is research showing us that that's not necessary to stop cross-contamination?
What we're saying is, if you wash your hands after you finish your patient, and the deep cleaning at the end of the day, so you still have to wash after each patient, but you don't have to clean the surfaces as much as you did during COVID. And that is what we now want to test this year in terms of swapping the surfaces. But what we're saying is that is still required. You cannot go from patient to patient without washing your hands. that should not happen. But washing your hands would suffice if the deep cleaning has taken place in the beginning of the day, and then washing before patient, washing after patient. But that continuous washing doesn't need to take place, and surface cleaning doesn't need to take place.
Do you see this changing? Is it going to be transitional because there's a new variant of COVID now that is as worse or even worse than the COVID-19? Is that going to change things? Are we going to stick to this? Do you see this changing again to what it was before?
What we are seeing is that it's actually changing back in terms of that it's not, the hand hygiene is not being maintained, and in terms of that they're not cleaning surfaces and they're not washing their hands. That is the observations that's currently taking place. It's actually returning to pre-COVID levels where the hand hygiene compliance is very, very low. So it was improving during COVID, but it's returning back to pre-COVID levels. And that's why we now want to, in 2025, repeat exactly what we did pre-COVID to see where we are with the hand hygiene actions.
Excellent.
I think there was another question regarding continuous hand washing, but I can take that at the end.